Our transformation journey really started about a year ago when we realised that we were seeing a level of growth in demand for mental health adult social care that was way beyond what we had expected. We couldn't get the data, we couldn't understand precisely what was going on. So what we then did was we brought in Channel 3 so that with the help of Channel 3 we were able to say, yes, we understand what the issues are, we understand both how they're being expressed and what the financial impact is, what the impact on people is, but also why is it that this is happening?
We invested heavily in early help and prevention in reablement services, and our impact evaluation has just shown not only do over 70% of people after that intervention no longer need us.
For me, you have to be future thinking, you have to be bold, and you have to stand your ground and make progress. So my whole leadership team wants to change, wants to be different, but we've just needed that support to help us to do it.
Contacted Channel 3 because we, like everybody else, are experiencing a lot of challenges, a lot of increase in demand. What is the impact for us in place? What does this mean for Lincolnshire? The great thing about Channel 3 was that they were able to come in, meet us where we were at. So it enabled us to save time, save resource and fast forward on that transformation journey.
We're a reasonable way into an improvement journey, 3 years along the line. And the stage that we're at now is looking at system change and basically creating a system that's fit for the future and supports our practitioners to create good outcomes for children and young people.
There are lots of places where we can use technology for better outcomes for people and improve their experience, but we do have to be brave and then to recognise that sometimes technology can be better than we are. We like to think we're better than everything else, don't we? So that the optimum thing is a human interaction, but it's not always.
They have presented me with information that I didn't know about my service. They've really shown me by doing reflective practice with practitioners that actually the vision I have doesn't meet my practice at this moment in time and that we have a long way to go.
Channel 3 are demonstrating really creative ideas and innovative skills and approaches that are really supporting us to think about what the future looks like and how we can create and design services that meet local need but are fit for the future.
It's a real partnership approach, really. We've got several different projects that are running alongside each other, which have really honest and frank conversations and really get to the root of what the difficulties are and then problem solve together about that.
So on the one hand, there's been the technical data side of just understanding the numbers. What is it that's happening? But linked to that, and critically important, has been going through what this means for real people. And what Channel 3 have been really effective at doing is to help us to get under the skin of the numbers, to see what's happening with this individual and that individual, and therefore, why is it that we're getting the numbers that we're getting?
How personable Channel 3 are, so they know how to work with people. They put people at the centre of everything that they do. They also align to our visions and values of keeping people at the heart of everything that we do. I also think the ability to enable those really strategic reflections, discussions, challenges in a really sensitive and non-critical way.
The work that we've done so far has really drilled down into the big areas that we need to change. And knowing that now and coming up with a collaborative solution to change is going to be key. So I found Channel 3 to be really, really enthusiastic. They're very person-centred, they're very outcome-focused, very collaborative and very forward-thinking and prepared to give us, difficult information but in a really, really nice way and helping us find a solution to the problems that we're facing.
It's the collaborative approach to the work. My feedback from my teams are that they feel engaged. It's very much a done with approach as opposed to a done to approach, and they are really thriving in that environment. It's also helping my teams to develop new skills.
We have a real issue about what was the data, both financial and activity, and Channel 3 have helped us through to really understand that to a level and a depth that we didn't understand before. And then on top of that, they've been able to give us the strategic understanding of how did the relationships work, what's the formality about the relationships between different organisations and different partners. So it's that combination of a series of different sets of skills that come together to make a really powerful product.
They've got a real social work expertise that they bring with their teams alongside their consultants. They don't feel like a team that is separate and different from us. I feel like they've acted as an absolute additional resource.
Channel 3 had supported us to set up a communities of practice where we get practitioner to practitioner reflection and challenge. So the team have developed this skill set of being able to positively challenge each other as well.
So I think the most significant piece of work is around the disaggregation of the Children with Disability Service from the Adult and Health Directorate to the Children's Directorate, and really thinking about a child being at the centre of that, whilst recognising the significance of the transition arrangement and protecting that part of the service to ensure that it is really smooth for young people that need support for longer because of their needs or that need to transfer to the Adult Directorate.
A really good example was one that I had the principal consultant speaking about the other day with a piece of work looking about a child's journey through our system, how they'd identified a challenge in our system, which meant in certain situations children would have to start again in that process if they were looking to access a service, which creates drift and delay for children. And so the ability to identify that challenge in our system, communicate it effectively, and then come up with a solution how we can operate differently will make a real difference with those children.
I know we're living in very challenging times. I know resources are limited, and I know we're all put under significant pressure to deliver savings. But I'm optimistic because I think we can do it in a way which supports people and deliver better outcomes and be more efficient.
The support to the workers to do with, because that's supporting with further skills and development that they might not have otherwise had the opportunity to see or feel, looking around the social care reforms and how we create a system that we can then add to as the social work reforms expand.
The agility that they had in terms of coming in to problem solve and identifying different opportunities where we can grow and develop in a different way.
It's been really important to enable us to think about those next steps, but in a phased approach, so it isn't overwhelming. We were able to measure the outcomes of those achievements. It's enabled us to feed in those aspirations into our strategy. How do we sustain this programme of change? We've got that agreed phased approach, but the most important thing is it makes a difference. It makes a difference to people's lives.